Good day everyone, my name is Yna Denolan, a BSN 2D student, and for today I will be doing NGT feeding or nasogastric tube feeding. So prior to this activity, this performance, all of the materials needed should be complete and or organized. So for today, I will be first washing my hands. I will maintain proper health protocols by wearing a mask to prevent the chain of infections. So now, let's start. Preparing of the osterized feeding. Here I am following the instructions per serving of the Cerelac. So I will use 5 tablespoons with hot water. I will let it cool down. Here are the materials needed. And now I will check the doctor's orders on the amount, type, and frequency of tube feeding. So now I'm ready to start the process. But first, let us maintain privacy and proper ventilation for the patient, and let us introduce ourselves in this procedure. Good morning, sir. My name is Yna Denolan, your student nurse for today. May I know your name, sir?
I am Ruben John Picaron.
Good morning, Sir Ruben. May I know your age?
I am 11 years old.
How about when is your birthday?
February 26, 2010.
Okay, thank you so much, sir. So for today, sir, I will be performing NGT or nasogastric tube feeding. So within this, sir, I will insert the tube. So natay tube langga. So gikan siya sa imong ilong, i-insert na to. So it will deliver into your stomach. Kay the doctor prescribed that as of this day, dili pa ka pwede mukaon orally. So in order to maintain your nutritional status and also maintain your health, so you can always have a full tummy, so we will have this feeding. Is it okay for you to cooperate with me today?
Yes.
Okay, thank you. Gather the necessary materials needed. Since I have already washed my hands and done my gloves, I will start in positioning the nasogastric tube. Now I am securing it with tape. Pour the prescribed amount of osterized feeding on a calibrated glass. So for this instance, I will use a calibrated glass, and as the doctor prescribed, I will feed the patient 210 ml of osterized feeding. Position the patient on high fowlers or semi-fowlers. Are you comfortable in that position, sir?
Yes.
Okay. Now I will be placing a towel on the patient's chest. So this will help in protecting the patient from the spills of the feeding. And I have already done my gloves. Next is to remove the cover of the nasogastric tubing while kinking it. Attach the aseptic syringe to the nasogastric tubing while kinking it. So I will be kinking it to prevent the air to enter the stomach of the patient. So sir, I will now listen to the placement of the tube in your stomach. Is that okay for you?
Yes.
Okay. Using my stethoscope, I will open it and then I will warm it and place it in the left upper quadrant or the stomach of the patient. So I will inject air into the nasogastric tube in the stomach, and I will listen for the whooshing sound. Now I'm going to aspirate and check the gastric contents. Gastric contents are aspirated to test for the pH value. So this is used to differentiate between gastric and respiratory placement. So we also note that the value of pH less than 5, its indication is gastric, and the action of the nurse is proceed to feeding. As here we assess the visual characteristics of feeding tube aspirates. Now, as we assessed earlier, it is gastric because it has a grassy green with sediment. May also appear clear and colorless, often with shreds of off-white to tan mucus or sediment. Gastric contents are also affected by several factors, especially when patients are receiving H2 receptor antagonist or with recent alkaline reflux from the intestine that may have elevated gastric pH. Kink the nasogastric tube and remove the rubber bulb of the septosyringe. Next is I will be pouring the osterized feeding into the septosyringe while avoiding the entrance of air by kinking it. So this will help not to cause gastric upset to the patient. Timing is key. I will not let the osterized feeding to empty completely into the septosyringe because it can have the entry of air. It is important to elevate the septosyringe at 12 to 18 inches above the insertion site or the nose while feeding. Next is I will be flushing the feeding tubing with 30 to 60 ml of water to drain the feeding. Kink the feeding tube once water has run through it. Detach a septosyringe, then cover the feeding tubing. So now we are done with the NGT feeding, sir. So I will now take off the towel. So thank you for today's cooperation, sir. So you will stay for at least 30 minutes in this position. So thank you again, sir. So now I will document the findings and wash the materials and also clean my hands. That is all for today. Thank you and Godspeed.